Good evening and welcome to the Families, Health and Wellbeing Select Committee, both to those attending here and to our viewers watching live on the Council's YouTube channel, Hillingdon, London. My name is Councillor Philip Corthorne and I am Chairman of this meeting. Details of the business to be considered today are shown on the agenda, copies of which are accessible online and under live broadcast. For those present in the room and intending to speak, please note that you will be filmed and any statements you make will be recorded and made public. A reminder to anyone speaking today that your voice will only be audible online if the microphone is switched on, so I'd reiterate my usual plea, myself included on that. We are not expecting a fire drill, so if the alarm goes off, please follow officers to the fire exits and out of the building to the designated meeting points. For those in the room, please switch off any mobile devices before the meeting starts or put them on silent. Please note that the councillors on the committee may use their laptops or tablets during the meeting to view the agenda paperwork. And before we move on to the agenda, I'd like to introduce the councillors and officers present. I'll start with Mr. Tony Little, who's not actually a councillor, was some years ago, Councillor Little to my left, former Councillor Little to my left, Councillor Jan Sweeting from the Labour Group, Councillor Kerry Prince, Labour Lead. On the Conservative side, Councillor Hima Mukrana, Vice Chairman, Councillor Judith Cooper, Councillor Paula Rodriguez and Councillor Becky Hagar. So welcome to all of you. And on the officer side, we have Darren Thorpe, Head of Business Delivery and Market Management, helping us with our major review. Ian Anderson we don't have yet. I'm hoping we'll have him later in the meeting, but we'll come to that. Vikram Ansrani, Director of Service Delivery from SEND, and Dominika Mikalik, I hope I've got that right, SEND Service Manager, and of course Anisha Teji from Democratic Services. So welcome to you all this evening. So with that we'll come to the agenda before us. So the first one is to note apologies for absence and to report presence for any substitute members.
No apologies.
Second item is declarations of interest in matters coming before this meeting. No, none declared, thank you. Third item is to receive the minutes of the previous meeting. So two things to say about that. Firstly, on the 31st of August we had an email from Anisha setting out information that was sought, or at the very least where we are in relation to the seeking of that information. That's the first thing I wanted to say. The other thing I wanted to add was I think there's an addition that's required to these minutes, because during the course of the discussion on safeguarding, you may recall, those of you who were here, I made the point about what happened in Rotherham, what lessons had been learnt by the local authority family and Hillingdon specifically, and how those lessons were being applied to our approach to safeguarding. I thought that was a critical question. The answer was equally important from Alex Coleman. It's not reflected in the minutes, and I think it should be, quite frankly. They're a matter of public record. So I've asked Anisha, if you would please, just to read an addition, please, that we've put together earlier.
Thank you, Chairman. Questions were raised on how lessons learnt from the incident in Rotherham 2014 involving young vulnerable girls had been applied to Hillingdon's approach to child safeguarding. It was confirmed that learning was captured from both a national and local level, and various areas of practice were reviewed through the Development Forum. A national panel has also been introduced to consider areas of concern across the country, capturing information and publishing national reports and ongoing feedback.
Okay, so with that addition to the minutes, which I move, I'll open up. Are we otherwise happy? Jan?
The minutes, yes, but there was an issue pending, I believe, page 2, and it's concerning the reductions of PAN for some primary schools, which is going to the Cabinet meeting of the 14th of October. I would have thought by now those schools that are going to be highlighted in that report, that information would have been available to us in this committee.
Okay. Can you advise on that, Anisha, at all?
Thank you, Chairman. So that report will come to committee in January for consideration by this committee. Sorry, just to add, it's on the work programme.
It's on the work programme. I think your point, if I've understood you correctly, was what about some information ahead of that cabinet paper. That's the essence of your question, is it?
Through you, Chair. Yes, there would be by now a list of those schools that have, liaised with the authority and their academies, etc., to have reductions in their PAN. That would already be known, and that information will be going to the October meeting of the Cabinet. All we're asking for, or I thought we'd ask for, is could we have information on those schools that are going to be included as schools to be go through the statutory process of reducing their PAN, so that we would have that information at this meeting, not the results of it, because that will be after the consultation has already come and gone.
We can certainly seek that information, as I understand it. Is that right, Anisha?
That's correct, Chairman. Also, the committee will have an opportunity to make comments on that report before it is finalised. This is just the draft report that's coming to Cabinet in October. The committee will have an opportunity to review the draft full report in January when it comes to this committee.
For you? Okay. Point.
Yes, thank you. Just to ensure the accuracy of the minutes, can we get the minutes changed to reflect that at the last meeting we asked for specific information about the EHCP plans that we received quite late, just to ensure that the minutes are correct going forward? Thank you.
So, in what way are they inaccurate? So, just to be clear, Kerry.
So, in the work programme it says that...
Sorry, forgive me, what page are you on?
7.
Okay.
Under work programme, the committee was keen to receive the report on access to education and healthcare plans for children to send at the next meeting. We asked for quite specific information to be included in this, and it wasn't minuted, and as a result we may not have received the full information that we would have wanted in the report, and the hope is that going forward this won't happen, and that we'd get the full report ahead of time with more than a day to scrutinise the information.
Yeah. I'll have more to say on that when we get to that particular item. But yes, I mean, I'm happy to note that. But I'll have more to say when that item comes up, if you don't mind. I'll park it there for now. Thank you. Can we agree the minutes? Can I take them as agreed? Okay, thank you. Right, so we come to the first item then, or agenda item 5, the major review topic. So Darren will be talking to us about that, but I'm just going to set the scene a little bit around this, because the discussion, I'm afraid, is going to take a slightly different course to that which the report suggests was going to happen, for the unfortunate reason we've not managed to secure a provider to be with us this evening to give us feedback, as I understand it. However, there is an opportunity, I think, this evening for us to talk about what came from the visit to Parkview, and I'm conscious there were just 3 of us there on that occasion. How we can hear about that from Darren. I've got some thoughts on it. My Councillor Prince and Councillor Corthorne, I'm sure, will have some observations to make about it too. And I think we can draw those strands, I think, to inform our thinking about what happens next. Now, I'm hoping, Darren, also you will be in a position to share with us at least a draft plan about how we're going to take this on moving forward. We've got one more session in October. We've got a session next week, which we'll hopefully hear more about as well at the Civic Centre. But I'm beginning to get the feeling we may need another session outside the meeting, quite honestly, to make sure we cover the full breadth and depth of what's within scoping. So I think perhaps having sort of teed it up in that way, can I ask you to sort of feedback to us on Parkview and generally your thoughts on how we can take this forward, please?
Thank you, Chair. Okay, so on the 11th of August, as the Chair has stated, there was a delegation that visited Parkview Court, which is an extra care facility in the south of the borough. As part of that session, the delegation was given a tour of the facility. We were able to see one of the empty flats to look at the equipment, the general tonsil equipment, which is provided in each of the flats. We also looked at some of the common areas, including the bath facility with the reflective lights and the relaxation period the relaxation area and the treatment room at Parkview. Following the tour, the initial session then was with the care provider that provides the care within the extra care facility, which is Comfort Care, and we met with a range of staff, both their unit manager, some direct carers, and also their head of home care and extra care. General feelings or general questions were asked around their thoughts regarding the use of assistive technology, and again, in general, it was positive feedback, and Comfort Care reported that actually they've moved all of their systems online. Carers can access all records online and confirm actions have been taken, and any actions that haven't been completed can be alerted to head office to follow up. Care plans can be updated in real time, and they're able to have their management team to monitor the delivery of their care service. Data protection and secure information management is in place. Any prescription changes are made in real time, and also interaction with families as they can log in and make sure visits have been completed, and there's also a portal that would then alert the care provider of any suspended packages. So again, previously that all would have been done either through manual care records or through telephones, but so with the system in place now with that provider, even their rota management enables them to ensure as far as possible that the same set of carers are providing care to the service users. There was a question then following regarding system failures and backup. Again, with any technology, it is dependent sometimes on the connectivity, and that can be sometimes an issue, not specifically at Parkview, but in general, there are some dark spots within the authority, which I think we've brought to this committee previously. And again, if a service user isn't actually wearing their pendant, then again that can create a problem. But there is a backup response regarding batteries dying, so then it would send an alert. With regards to how the service users react to the use of technology, and I think there's a very good point made by one of the carers, is that sometimes the service users may feel reluctant to press the button, so to speak, so as not to bother people. So again, there's some work there on educating the service users that actually the technology is there for a reason, and for whatever the reason is, they should feel free to press the button. There was also then a final question regarding training for Comfort Care staff, and the head of extra care and home care then stated actually it's a contractual obligation. There's also CQC requirements, and LBH had also provided training to their staff during the transition. So is there any questions on the session with the care provider?
No one's indicated. Judith.
Thank you, Chairman. This may be a more general question than just referring to that particular unit. I wonder about having all systems online, and whether particularly with probably domiciliary care, some of our people, once the person has gone, taking their mobile phone with them with all the care plan on it, they have got nothing left to show them what has happened. And if they have dementia, I hate to mention my mother here, she's not in this borough, you'll be glad to know, or even in a neighbouring borough, but she hasn't got a clue what has happened, and no one seems to be able to get round to providing her with a note in a notebook to tell her that someone's been and what they've done. And that seems to me to be a big gap with online services, and I think we will also have a problem with older people who don't have access to smartphones, who would wonder who Alexa was, and they perhaps need something else. they need something more and different than just online services.
I mean, just to add to that, I think Councillor Cooper has made a point that I've actually discussed in a different way with Darren, because whilst service users may, for all kinds of reasons, not be as forthcoming as we would like in this review, I think there's an opportunity to hear from families and carers, most certainly in terms of how this can move forward. And so that the sort of feedback we've had from Councillor Cooper, I think, is an important component of that. And what I've already suggested to Darren is that we look to include, through some means or others, through established engagement mechanisms in the borough, some feedback from families and carers to help inform that moving forward. You've got any specific point on that?
Yes, just coming on to the second session at Parkview actually was including residents, and we asked them about what their experience of living at Parkview was like, and in particular the use of the technology. Now I'll come on to some of the other issues that they raised as well, but when it came to the technology, they did feel as if there's been adequate demonstrations about how to use the technology, and they did feel comfortable in using it. Although taken on point the comment made by the carer about sometimes being reluctant, we didn't get that direct feedback from the service users at Parkview. If I may just come on to then getting further feedback from families, I'll come into it in more detail in a second, but the daytime session on Monday actually includes service users and their relatives, as well as support workers. So again, that's something perhaps we can further explore as Councillor Cooper's point around total reliance on technology and making sure there are backups in place and their reluctance.
No one else is indicating. So just want to indicate the thoughts from me at this stage. I mean, this is the first time I've chaired a review around this, any kind of major review, frankly. So I suppose the process for me is quite something getting used to. But I think I saw enough at Parkview to whet my appetite in terms of where the opportunities might be. And I think you fleshed out a fair amount of it. I mean, what struck me, I think, we talked about coordinate my care when we were there. So that was the opportunity to improve the interface between GPs, nurses and social workers. There seem to be opportunities to improve the delivery and effectiveness of domiciliary care, which is a challenging area of service, as we know. So I think that, to me, it's about drawing out these initial thoughts from that first experience of speaking to providers and carers, developing those thoughts through further discussion with service users and voluntary sector people as per the programme. I owe you an apology, Darren. I hadn't seen this before now. I'm conscious that you have tabled this, but I'm only just seeing this for the first time, this programme. So what you seem to have done, no doubt you'll want to say more about it, but essentially you set out what that programme might look for the coming weeks. So would you like to say a bit more about that?
Absolutely. So bearing in mind the original deadline for going to Cabinet with recommendations, and also the availability of service users, relatives and some support workers, we've actually arranged a session for this coming Monday, the 13th at 2 p.m. in one of the committee rooms, where we've arranged for a service user and her mother from a supported living unit, Swan House, in West Drayton, to come and talk about their experiences and also what they would like to see be developed in the future, and also some voluntary sector representatives, some of which are coming with direct service users, others are just coming as a voice for their service users. So again, representatives from Hillingdon Mind, the Carers Trust and the Alzheimer's Society to come along and express their thoughts regarding the use of technology, how it could be further developed and how they're using it at the moment. So that's set for this coming Monday. We're also hopeful that the previous father and son that I mentioned would be able to attend that session. The son is actually a resident of a supported living unit, but his father, as well as obviously having a son in a supported living unit, is a domiciliary care provider, a care worker. So hoping he can actually give both sides of being a user of technology in his profession, and obviously the peace of mind that it would provide as a relative of a service user. So that was set for Monday. Then moving forward using the same timeline, in October we've identified a range of technology providers, so not direct service providers but the actual providers of technology. I do have a range. Now most provide similar gadgets and products. Some are more specific, and in our conversations with them to warm them up for the event, they can either come in person or provide a virtual session where they can give a demonstration. So depending on the feedback and thoughts of the committee and the time, we can provide a virtual session as well. Some of these providers have already seen their virtual presentations, and I feel it would give you, full insight into their product range.
Thank you, Darren. Kerry?
Thanks. Just two questions. First, I'm curious as to why we were unable to get a provider for today. Is it a bad time of year? Just out of interest. And the second one is we will be hearing a lot from people who live in supported accommodation, but I don't believe that we've got anyone scheduled to hear from who has assistive living technology but stays in their own home. That could be quite unless I've missed something, but that could be quite an interesting, different perspective.
Yes, with regards to a provider attending this evening's session, I think it was mainly just scheduling. We did identify a provider for a further visit, so we could see some of the wider technology in the unit, such as fridge monitors, etc., temperature. But actually, the unit wasn't in the borough, and they haven't yet developed that in the in-house, in the borough facility. With regards to the different range of care providers, again, we have gone extensively to try and get a range, and these are the individuals that have come back and said they'd be willing. With regards to the sheltered housing, in a way, it's as close as you're going to get from someone in their own home that just has carers coming on site. There would be a domiciliary care provider coming on site rather than the extra care facility where the carers are there all the time. So it would probably give you as near to that representative to say someone actually just being in a standalone. But again, we do have opportunities to run, if the committee would like, another daytime session where we can try and get some more witnesses from that area. Similarly with the care providers, we do have, we have spoken to a range of providers, whether that be care homes, supported living, domiciliary care. We have fortnightly conversations, group calls, and we did put out a call to arms for people to come in and provide their experiences. So we may have some more come forward, and that we can offer that up to the committee.
Jan?
I have some concerns about what's happening here. 4 concerns, actually. That only 3 attended the meeting in August, and it would appear that the main part of this meeting is just to have a feedback on that, which is all very fine, but we'd hoped for something more fully at this meeting. That no service provider was at this meeting, that there's a late notification of the Monday meeting, and not all of us can suddenly find time, and it's a very important meeting on Monday, and that the October meeting seems to have now missed out local authority exemplars. So I don't know whether we're going to get something from other authorities that have done really well in respect of this. But it all seems to be moving sand here. We thought that we had a a timetable for all of this, and the timetable seems to have at least partly gone out of the window.
Well, I can respond on part of that, Jan. I mean, first of all, the fact that only 3 members attended the last session was actually in accordance with advice given at the time, because of the fact we were speaking to service users, and I made Kerry aware of that at the time. Yes, but by all means do. Yeah.
We're fully aware of that. We realise that, but we've got this main meeting that we're discussing because we haven't got this service provider here that would have taken out a chunk of this meeting. You know, a lot of the discussion is around that visit, which we realise that only 3 of us could have attended. We accept that, but it's made one of the only meetings that we've got, and we've got a very, very short timetable here that's discussing something that only 3 of us were at that particular session. It just seems a waste of one of our
yeah, and I did. Yeah, I share that, and I think one of the things about these reviews is the way they come together isn't always within our control. And I made the point as soon as I realised that we couldn't have a provider this evening, whether we could get anyone else along, and there wasn't time to do that, to get anyone to commit to come along, which is regrettable. You say no programme. Well, I think for the first time we do have an actual programme with some detail on it this evening. That's something we asked for last time. I mean, I've got 1 or 2 comments to make on it, actually. Sorry, have you got it? You have. Well, yes, indeed. Well, we've got the initial timetable set out in the scoping report. That's absolutely right. What I asked for at the last meeting, if you recall, was a programme with detail within that, with what we would cover in each session. Now, I said at the beginning of the meeting, I am conscious that time is slipping by. I do think that although we have a meeting on Monday, the confirmation of that has only come today, and I think we've only had it in the last 24 hours or so. There was always a possibility of a meeting next week, and I made Kerry aware of that a couple of weeks ago. I think some guidance from Darren will be helpful for the Monday meeting, because last time the advice was it would be best if we don't have too many members. Are you still advising that? Because I'm loath to say to members we need to keep the numbers down if people can come, because I think we should encourage that. So can you advise on that, Darren, please?
I think part of the recommendation to reduce numbers at the visit to Park View was, again, partly down to the pandemic and infection control measures. That's obviously no longer in place. And yeah, I wouldn't have thought there'd be any need to limit the numbers in the meeting on Monday.
Okay. I mean, all I can look. I share what you're saying about this, Jan. To a large extent, I do. I think this is a bit of a learning for all. Certainly me. I've not been involved in one of these before. I think the very nature of these things means that things can slip occasionally. What we need to do is be nimble with our footwork in terms of getting new opportunities to get people in. I think that is the very nature of these things, and those who have done more of these reviews in the past, I think, will have a sense of that. But I think that for the first time this evening, we've got something that's reasonably concrete, always subject to change, I'm afraid, but a little more of a sense of where we're going, who we're seeing, and I think looking at Monday's session, I mean, we're encouraged by the appearance of Carers Trust, for example, because, of course, they're a significant partner organisation that deal with people who do have support needs and who are exactly within the target area that we're talking about. So I'm encouraged by that. I would ask the question about the fact Brunel University don't appear anywhere here at the moment, because that's something, or have I missed it? Because I'm looking at this for the first time, sorry.
Yeah, I've just
got that. Have we got Brunel in here
October,
anywhere?
the higher education partner.
I beg your pardon, yes, of course. I've just seen this, as I say, for the first time. So I think it's coming together. I mean, obviously, it may be that there's a need to have a further session outside the meeting. I, for one, am very happy to be involved in that, and I encourage members to support that as best they can. But let's see how we go. Okay. Any other thoughts on this, Kerry?
Thank you. Am I mistaken in thinking that at one point we asked for an online survey way that residents could respond about this issue?
Darren?
Yeah, and we did speak with the community engagement team for looking at that, and so that could still be in development. So we have spoken to the community engagement team on that, and I think that partly led to this outreach into who would be interested in coming and talking to us from a wider impersonal session.
Okay, January indicating.
It's just about the other local authorities that we can possibly learn from. Is that mentioned in the audit? Because it's mentioned on the page 18 of the report. You know, local authority examples and future direction. So, are we approaching other authorities on this?
Yeah, there is there have been a number of online seminars which my colleague has been attending. I think primarily a lot of authorities are in the same the same state of their delivery of this service and the wider digitisation. There is a lot going on in this area at the moment. So whether we could find a direct exemplar for us to follow through, we'll continue to try and identify. But at the moment, I think we'll find that most of us are in the same situation, particularly regarding wider digitisation and 5G.
Thank you. I think, Anisha, you've got something to add, I think, Anisha.
Yes, thank you, Chairman. It was just to add, I know previously members requested a virtual headset training session, and officers have been trying to arrange that for the next committee meeting, so maybe to take place prior to the actual meeting, and that will be a practical session, so maybe an hour or so before the meeting, if members are okay with that.
I think it would have to be before the meeting because we've got quite a chunky meeting next time round, to be honest. And it would be really helpful to have this all on one piece of paper, if that's possible. So that Anisha's just mentioned isn't on the document here. So I think perhaps if we can have that addition, plus the other point to be raised. I'm very happy to talk offline about the need for an additional session outside the meeting. I think in principle that's not a problem. But I think we all... I think the mood of the meeting, and I share it, really, we want to feel that we're getting some traction here. We're covering all the ground we said we would, and granted it's not easy to get all the people together at the same time, but I'd just like just a little bit more comfort around that. I think that would be helpful. Councillor Hagar.
Yes, thank you. Just one further point that I was just interested in is, can we get a ratio of exactly ages and who we're looking into here, because I'm very conscious that at the last meeting as well we did speak about the younger people. They're in, and exactly the same as Councillor Princeton, those that are actually in their own homes. So I'd like to sort of focus on that as well. So we're not just including the over 70s, but it's under and those with disability that are living at home on their own. But just the ratio so we know that we're covering everyone, Chair. Thank you.
Okay. Fine. So we've talked about the outputs from Parkview. We've talked about a programme. For the first time, we've got more meat on the bone in terms of how this is going to look. So it's coming together. Any other points before we move on then? So essentially, are we broadly? Are you indicating? Do you want to say something more? Did you?
Sorry, it's just that I mentioned further feedback to some of the other points that were raised at Parkview, and for those that weren't in attendance, there were some queries regarding from the residents, such as the time delays on the doors, etc., and things such as sensor pads for the garage. A colleague of mine actually looked into that, and most of which were already in, had been reported previously and were in train of being acted against, and those that hadn't been reported previously are now in being acted upon.
So as I say, we've talked about Parkview. We have a programme of sorts now that needs a little further work, but we've at least given it some oversight. What about Monday? What's the plan for that? Have we got more information about it? Because I'm conscious that some people sitting here are hearing about it for the first time. Can you advise Darren on that?
And it's 2 p.m. in room A422, but I believe a committee room was being looked at.
Yes.
We'll get details of that in the next day or so, Anisha, will we?
Yeah, I'll update members tomorrow.
Okay, fine. Okay, well, with that, can we agree then that we've, broadly with the programme that we've been presented to this evening? Agree how we're going to take this forward, noting all that's been said about the need to get everything we possibly can in. So I think with that, can we move on? Is that agreed? Thank you very much. We come on now to the next agenda item, which is special educational need and disability, SEND provision within Hillingdon. I think it's worth me just saying a little bit about how we got to where we are now on this. A short while ago, I think we were approached for any comments or observations that we might have about what would be useful in this report. And obviously, and I spoke to Councillor Prince about that at the time. We shared some observations. What drove my thinking around this was what we heard out of the last major review on autism. So some of the feedback there, and I wasn't present for it, but the minutes recalled that reports were around delays with ECHPs, a backlog with those, about receipt of services, having had those, about access to SEN support either in the mainstream setting or indeed special SEN places in the school. So there were issues of that sort that we were hearing about, which gave rise to concern. We did have a report back from you, Vikram, in the early part of this year, which was shared, and that painted a sort of a much better picture in terms of how we were progressing with ECHPs and other aspects. You referred to transformation, which was important given the fact that numbers are increasing so much. And really, I think we wanted to understand more about how that's progressing now, sort of a few months down the line, in terms of ECHP's service delivery, house transformation supporting, and particularly when we talk about children with disabilities, that seem that serve those particular individuals where there's an eligibility criteria, and where there's a possibility that people could miss out potentially, or not be able to access the service. So I suppose these were our broad thoughts in terms of what we wanted to see this time round, as well as anything that you can share with us in terms of performance indicators against the national picture for context, really. I think with that, I'll hand over to you. No doubt there will be questions, I'm sure there will, but let me hand it over to you now, please, if that's all right, Vikram. Thank you.
Thank you, Chairman. Can you hear me okay? Good evening. Brilliant. Thank you for that context. I think that's incredibly helpful in terms of just setting the tone for where we are at the moment in Hillingdon. So, members, I hope that you've had the opportunity to go through the paper in some detail and provided a subsequent paper just in response to some of the further feedback late last week. I'll spend this evening going through a few of the key headlines in regards to service delivery and the position, and then in terms of questions and feedback, I'd be more than happy to answer those. Just to start, I've had assistance from colleagues from wider services, specifically around SEND transport and the Children with Disability Service. So if I can't answer those questions this evening, I'll certainly pass those on to our colleagues, and we'll ensure we get adequate responses back in due course. And finally, just to state, I'd be more than happy to have queries followed up regarding specific schools. So if there are questions or queries in regards to specific schools, we can take that conversation offline if you wouldn't mind. The report hasn't covered SEND place planning, as I believe that report is coming through my colleague Sarah Phillips quarterly in terms of the wider capital development within schools. And also just to note that the piece around the financial impact and isn't recorded in this report at this moment in time because there's a significant level of work that's in progress at the moment, specifically linked to our DSG recovery plan. We're working with the DFE and the ESFA on that plan, and that work is coming to a head in the coming weeks or so. So as soon as we have a further update there, I'd be more than happy to present that to you all. So if you don't mind, I'm going to go through some of the headlines of the paper, and then I'll take questions. In regards to context, I thought it'd be quite helpful to set the scene. So since the SEND reforms of 2014, we've seen quite a significant growth, both nationally in London and, of course, in Hillingdon. Nationally, we've seen an 82% growth, and in Hillingdon, we've seen that at 90%. In response to that significant growth that we were starting to see, in late 2018, mid-2019, we embarked on an ambitious transformation program with the idea, similar to our children's social care colleagues, to get the earliest opportunity for intervention, and we developed a SEND advisory service. That was essentially a multidisciplinary team which would meet needs much earlier than having to wait for children to access education, health and care needs assessments. So that took place in 2019. In terms of mobilising the team, the back end of 2019, when all of the senior leadership came into place, we then launched those services and those referrals 2.5 weeks maybe prior to that first lockdown in March. But what was really positive is, although that we were aware of some of the challenges within the school arena, we had 90 plus attendees attend council chamber at that moment in time. So although there were concerns and we acknowledged them, there was clearly an appetite from all leaders within the area to improve things. And one of the bits of feedback that I was hearing significantly within the first few months of my tenure was around backlogged EHCPs and the delay in some of those assessments coming through. We were then hit with COVID, and that was something that none of us could have expected. But actually what we gleaned from that period in time was we worked even closer with some of those school settings. And where we didn't have the strongest relationship with some schools, we ensured that we strengthened those. So we delivered an extended support program from 2 of my 3 portfolio areas, so the Educational Psychology Service and the SEND Advisory Service. And my colleague Dominika Michalik, who's the service manager of the statutory world, there was not much let up for that area. So although for a short period of time, a bit of the statutory regulations were relaxed, by and large, we were still responding to requests for education, health and care plans and supporting schools with risk assessments for children with EHCPs. In regards to that period in time in particular, one area of positivity was our increased engagement with some of our stakeholders, namely our Hillingdon Parent Carer Forum, as well as SENDIAS and some of the voluntary agencies that work so intrinsically close to our children and our families. I'll reference HACS as one of those. So at that point, we were having fortnightly meetings with those stakeholders just to ensure, A, they were up to date with the latest developments that felt like they were coming daily, but also to hear feedback in terms of how things were going on the ground in Hillingdon. As we move out of our response, and although we're continuously responding to COVID and supporting our stakeholders, in terms of the SEND service, so the statutory service in particular, what we've noticed over the past year is that we've seen 4.1% of our school population in Hillingdon have an EHCP. That's against the context of 3.8% in London and 3.7% nationally. So it's safe to say we have a higher proportion or percentage of children and young people in our school-age population that have an education, health and care plan. Now, that's also met with SEN support. And SEN support is that first tier of support in schools, that's locally led by schools. And what we see in Hillingdon is that we have a reduction. We have 10% of our school-age population on SEN support against the national backdrop of 12%, and in London, 11.4%. And those two are challenges that we recognise. Higher amount of children with EHCPs, but also not enough, or if you compare the percentages, we haven't got as many schools as we would have thought engaging with SEN support. As part of that process and through transformation, we've ensured that our SEND panel, the decision to issue plans and to start the process of assessment, is much more robust now. So we, in terms of the decision-making processes, we have external stakeholders who are there, who support those decisions, whether or not to assess or not. Anecdotally, quite interestingly, in late 2019, we were seeing a number of mainstream settings go through the process of a request for assessment because they essentially were using that as a first step to potentially move that child out of their setting. It was because those needs they felt couldn't be met. But what we're seeing at the moment, and whilst it's still early days, is a number of cases going to SEND panel, but actually that setting remaining to be that setting, just with the top-up that's provided to meet the needs. So we're starting to feel, although it's small, a bit of a cultural change around how we're meeting needs within the local area. And one of the key metrics is around our 20-week performance. So as part of the SEND reforms in 2014, it was expected that needs assessments would take 20 weeks. So from the process of start of assessment to finalising a plan. I'll just go through some figures very briefly. In 2019, our annual percentage was 22%. So 22% of our cases were completed within 20 weeks. In 2020, that figure was 34%. Our year-to-date of 2021 is 82%. So there's been a significant drive and increase in completing assessments within 20 weeks. The national backdrop is 55% of local areas completing within 20 weeks. So that's the current context that we're working with at the moment. And in part, that's been due to an established full-time workforce within the statutory service area, but also due to a number of backlog cases which have now been finalised and we've confirmed places for. So to a degree, it wasn't that officers weren't working as hard as they are now, but actually when you've got those number of backlog cases in the system, month on month, you're always going to have distorted statistics. So once we worked our way through those assessments, we're starting to see tangibly month-on-month increases. For the last 2 months, we've seen 100% in 20-week processes. So there's real positivity there around the way needs assessments are looking. And then the final bit just around the statutory service, which is incredibly important, is the phase transfer process. So for children and young people moving from one phase of education to the other. The deadline for that to confirm a placement for September is in February. And this February, we confirmed 96% of our cohort who were moving from one setting to another, with the remaining 4 named before the end of the academic year. Work's already started on looking at next year's cohort, so we start that process all over again as soon as we start a new academic year. I know one of the queries that we've had has been in regards to children and young people not in education, so having an education, health and care plan, but not yet in education. And whilst there are still significant challenges, and one being around local specialist provision, that number is dwindling. The current position, the date of the report, there were 17 pupils without a placement. We're currently down to 6 pupils now without a placement in statutory school age education. 6 is still far too high in our books. We want to make sure we're securing provision for every single one of those children. We're working with our families to communicate. It's the SEND officers' roles to be communicating and consulting with appropriate provision, and that's the work that's ongoing. I would just like to say, though, I think some of these challenges have come through COVID because these new requests for assessments came after that phase transfer process. And what we've seen in terms of delving into these numbers, a lot of these children came through our panel post that February the 15th deadline. These were potentially some early years providers providing assessments to us at the latter end of the last academic year. And that was that was no one's fault, but essentially these were children potentially who weren't accessing a lot of early years education at that moment in time. So schools, PVIs, early years settings were only able to provide us with the information once they had the appropriate information to take to SEND panel. And we're continuing to work with those families to secure the most appropriate provision for those children. In terms of early intervention, because that's an incredibly important strand for service transformation, we recognise that EHCPs were growing, but we said we can meet needs earlier if we think about a middle tier of support, which is coming through the early support funding route. Since its inception in early 2020, caveated with the challenges of COVID and schools not operating as schools for quite a chunk of that time, we've had nearly 250 children and young people access those settings, which demonstrates that the pathways are being promoted appropriately and accordingly, and we are starting to see engagement from our schools. There is still further work to be done, though, so I would expect as we enter a level of normality this academic year, we'd be seeing more and more young people and children access early support funding. It's a real drive for us as a service. We utilise every sort of opportunity through SENCO networks, which are incredibly well attended, to SENCO newsletters, which are often monthly, just to really highlight those pathways that we have now developed within the borough. Away from early support funding, we're also focusing our attention on SEND reviews. SEND reviews are essentially self-assessments that schools will be doing to improve, standardise and share good practice in regards to what's happening in the schools community. It is NACEN accredited and it's something a school can do independently. However, the beauty of it in Hillingdon is that we have the right workforce to support those schools, in that when they have completed that self-evaluation, we have officers who will then provide a year's worth of support through something called the inclusion commitment. So where we find areas of improvement, those officers will support schools for a year to identify where some of those challenges are. And this year we're looking at a number of metrics to identify schools. So although there will be schools who self-refer in for a SEND review, we're also looking at metrics such as schools with a high proportion of children on the HCPs or on SEN support, as well as working with our school improvement colleagues where there could be potentially schools for concern. So using wider intelligence within the schools community to support some of those school settings. Finally, in terms of next steps, this academic year, I should say, is going to be an incredibly important one for us all within the service and wider. We are confirming, as I mentioned previously, some really strong engagement with our SENCOs, and I expect that to continue to be increased. We want to see an increase in access to early support funding, so those pre-statutory pathways, as well as SEND reviews, as I've just mentioned. We've actually got 10 SEND reviews booked for this autumn term with our schools already, with another 15 due to take place between spring and summer. In the back end of last academic year, we refreshed our governance structure through the development of a SEND strategic partnership board and an operational group, and underneath that 5 priority groups, including co-production, early intervention and inclusion, transition planning, SEND sufficiency and place planning, as well as health and social care engagement. This year, over the next couple of months in particular, we're focusing on refreshing our SEND strategy. That's something I'm taking ownership of and working with our SEND Strategic Partnership Board on. So we have an extraordinary meeting next week just to go through the first iteration, and following that we'll go through a period of consultation with our wider stakeholders in regards to that strategy. Be remiss of me not to mention the DSG recovery plan, as I just touched on right at the beginning of this session. So we are working with the DFE and the ESFA on constructing a plan which we feel will get us to a balanced position in a few years' time. At the heart of that plan, from a SEND perspective, it's around 2 things, and it's the 2 things that I've just mentioned. Making sure that we are providing early intervention and getting that wider systemic inclusion within the borough, but also ensuring we've got the right sufficiency of specialist places within the borough. So those are the 2 key strands from a SEND perspective. The DSG recovery plan is wider than that, but that's the SEND point. I think I'll pause there for breath, first of all, and then I'm more than happy to answer any questions that you may have. Thank you.
Thank you, Vikram, very much for that. I mean, it's a very thorough, wide-ranging report, and I'm encouraged by what I see in terms of how we are looking to transform the service. Clearly, that is something that we must do in response to the growth in numbers. But I'll start the ball rolling with a couple of questions, really. I mean, first of all, I'm delighted to hear about the progress with the ECHP assessments, because we know that's been a problem. But of course, an ECHP assessment is a means to an end, I guess, rather than an end in itself. And my question is, of the numbers we're currently dealing with, how many people are still looking for support, a package, or whatever the assessed need happens to be? What sort of numbers are we talking about? That's the first bit. I do have a second question, if you can just make a note of that. My second one is around what we're reading on pages 24 and 27 of the report, which is very much around the non-statutory support. I mean, it's encouraging to see that we've had 248 odd successful bids for that sort of support. But the report sort of later on talks about there will be children who can't access services nevertheless, for whatever reason. So I'm just keen to know what sort of numbers we're talking about in the scheme of things. Are we talking about a large number? Can you give us a rough sort of figure? I think I'll probably kick off with those 2 questions for now, please. Yeah.
Thank you, Chairman. So the first question in regards to EHCPs, we would measure success in terms of how plans are being delivered through provision, making sure that we've got the right provision for our children and our young people. So of that, I think I referenced 6 pupils at the moment that are out of provision through statutory school age. Within that cohort, though, we will still have pupils who potentially are accessing home tuition whilst we're finding the most appropriate provision. Now, that is typically what would happen as a snapshot throughout the year, and we're working to secure the most appropriate provision. When we finalise an EHCP, we provide that setting with top-up funding. We discharge those responsibilities onto that setting to deliver the provision. So we're in certainly a much more positive place in terms of then securing the outcomes for those young people. But as it stands, it's the 6 that are without that provision in statutory school age.
Forgive me, because I take an informed interest, but I'm not a professional in the field. So these 6 we're talking about, so that may be provision that may take the form of a special SEN placed in the school and or support within a mainstream learning environment. Is that right? So it's a bit of a mix in that figure, is it?
Yeah, so an education, health and care plan, irrespective of where that child or young person goes, whether that's a mainstream or a specialist school.
You can cover the second question and I'll be quiet and let others come in. So.
Yes, so in terms of pre-statutory support, we are incredibly keen to expand that as best as we can. You rightly touched on the point around, in some cases, potentially some pupils can't access that support. I think that was a note from one of my colleagues in regards to the Children with Disabilities Service, but I know that is being reviewed. One of the positive recent developments has been through the Stronger Families work that's taken place, again, within the context of trying to meet needs at the earliest opportunity. So where potentially one service may not be able to, through things like the Stronger Families, we will be able to triage the most appropriate provision. If I talk on behalf of the SEND Advisory Service, that pre-statutory service, not only is a robust process in place to access that support, but schools are more than familiar now, or hopefully are starting to become more familiar with how to access that level of support. And one of the key strands to that is our focus on taking schools and settings on the journey, but also reflecting on the feedback heard. If I can give you an example, one of the things that we've developed is early support funding, and that's that middle tier of funding to meet needs before any HCP. In June and July of this year, just gone, we worked with those school settings 1 year on from developing early support funding to hear their voices, to hear some feedback and understand what was working and what wasn't working. So we're constantly adapting the service based on the feedback that we're receiving, and where we are hearing of gaps, we're working to address those.
But you can't give us a ballpark idea of what the numbers we're talking about then? Or can you perhaps let us know if you can't tell us now?
I wouldn't be able to provide that answer here, but that's something that I can go back to colleagues with.
Right, who's indicating? Okay, it's going to be lining up. Right, okay. Where shall I start? Okay, well, in no particular order. I'm going to start with Mr. Little, if I may, please. And I've got, let me see who else I've got. I've got Jan, I've got Becky, and I've got Heather. Okay, please, if you would, Mr. Little, fire away.
Thank you. One of my concerns over the last few years, as no doubt members have been bored to hear, has been the growth in the spending that hasn't been anticipated period by period by period. And even this year, in the first 3 months, we're estimating an overspend of £5 million. And that's obviously a combination of the price of finding somewhere for a pupil, and particularly out of the borough where we've got such limited capacity, but also a factor of the numbers. And in the data that we've been given this evening, it seems to me that the range of pupils in schools, if I take a primary example, that Harmondsworth has got 5% of its pupils with an EHCP, Bourne has only got 0.9. Harmondsworth has got 25% of its pupils on SEND support, and Bourne has only got 7.5. Now, you would expect some variation, but that variation looks significantly higher than you would expect from the type of people that we have distributed around the borough. You know, the people who live in Harmondsworth aren't so badly affected by aircraft fumes that they all need EHCPs, I would have thought. There must be something else in it. And are there incentives for schools to get people onto EHCPs that are working against the proper development of the service, i.e. that it goes to those who are cleverest at getting their pupils into the system rather than those who most need it?
Pick up on your first point, thank you. So although you've got the percentages there, I think it's just important to note that the percentage of pupils with the HCPs or on SEN support is against the percentage of that school roll. So when you work out the actual figures and the pupils that are accessing those numbers, it's relative to the actual school roll. So for instance, you will see a school quite low down with, let's say, 1% of their roll with the HCPs, but carry a total school roll of 1,200 against a school much smaller with a percentage of 4%.
The example I picked, they were very similar in size.
I think it's fair to say two things. From an SEN support perspective, it's our schools that will register pupils on SEN support. And one of the things that we're really keen on doing this academic year, as mentioned previously, one of the metrics that we're doing to support schools is the high proportion of children on SEN support and with the HCPs. So we are using that data to support our schools even greater than we were previously, to understand what some of those challenges are, because there are going to be nuanced challenges within the borough. So where we are seeing schools, we'll take Harmondsworth in particular as a school that's got a high percentage of children with the HCPs and on SEN support, that's one of the drivers that we would be using for that school in particular to support a SEN review. What's also positive, and just picking out that one school, and I said I wouldn't, but actually that member of their senior leadership team is now a part of the SEN Strategic Partnership Board as well. So it feels like we're capturing the right representatives to carry some of this work forward. So where we are seeing a disproportionate amount of pupils on EHCPs, I think potentially there may have been a legacy issue previously where the system wasn't as equitable as it currently stands. So everything from phase transfer process, we are working with all of our school leads to ensure that we are disproportionately affecting one school or the other. That is within the context of parental preference, which doesn't necessarily affect mainstream as much as it may for a type of provision, but certainly if we're talking about schools that are closest to that resident, we are reviewing the most appropriate place for that young person or that child, and we are reviewing that within the context of what the total school roll is for, or the percentage of the HCPs on that school roll. That's something that we have a bit more control on. I might pass to my colleague Dominique, who may be able to give you a bit more.
Thank you, Vikram. I just wanted to add, because you mentioned how do we as well support the schools on low plans, whether they are on the direct journey, if you like, in the right pathway to supporting children with SEND, whether it's through the SEND support or through plan. So we developed within the SEND service few kind of strands where we want to ensure that we support the schools regardless whether they are on statutory service or not. So that would be through, first, Vikram mentioned a more robust panel, so feedback to know, for instance, to request for the statutory assessment. We give the feedback not only to parents but to the referral to the school, following with the phone call and conversations, just to ensure that they understand what was not sufficient or what is the issue with the particular pupil, so that we can support them. And secondly, we also developed a training very much focused for SENCOs and SEND leads, very much focused on the statutory work as well. So again, so that we support these settings on a low percentage of plan and support to understand whether the children need that pathway. Thank you.
Indicating Councillor McCartney first, if you would, please.
Sorry, thank you, Chairman. Vikram, thank you so much for your presentation. You talk quite a lot about the school settings, which is great, but I want to know what specific support do we provide children with EHCPs who are electively home educated, and also do parents and carers also receive any kind of support or additional training? Thank you.
Thank you, Councillor. Yes, we developed together with our colleagues in participation team a guidance where we have very clear structure and guidance for parents who decide to electively home educate children on SEND support and with plans. Our SEND officers are working closely with elective home education officers to guide parents and to also ensure that we provide the right provision. As you know, electively home educated children with plan local authority do not provide funds. So that is parental responsibility because it is parental choice. However, we do guide parents where we feel whether this is the most appropriate, and we also review them more often. So in law, we have to review them 6 monthly. This is what we do, and we are quite, we have 20 at the moment. Thank you.
Thank you. Councillor Prince?
Thanks, good timing. Following on from Councillor McMahon's question, when you say you review them, what does that involve? How do you monitor the quality of the home education they're receiving?
Thank you, Councillor. That is very
tricky question because I think in the SEND world there is no particular statutory guidance, so we have to try our best practice learning from colleagues around the area, but also trying to involve our in-house services, so again through the participation, access to education, as well as SEND advisory service, what we do, we review them through annual review process, and I think education healthcare plans for children who are electively home educated are very bespoke packages because there are very various scenarios. So I'm happy to provide out of this some more context or examples if you like, but there are very often children who either achieve very high in some area and parents want them to be even more encouraged but very low in the other, which provides very difficult for the school to, they would have to have very bespoke package, or children are simply, some of them are end of life and parents simply want to spend the time. So there are different scenarios, but we do review them through annual review process together with education health, access to education team. Yeah.
Councillor Sweeting, I see you're champing at the bit, so there you go.
No champing here. There's a couple of issues before I get to my questions, if I may. The audit that you've provided us on individual schools, for one school that I am very much involved in, the information seems to be not accurate at all. Insofar as the number of children with education, health and care plans at that school, using my little computer to find out the actual numbers, it would suggest 15, where I have information which I can share with you after the meeting, which says that this school actually has 26, with another 9 in the pipeline. And if we're talking about statistics, you're talking about, was it 6 children that are not placed? Well, there's 4 in this particular school, and I can again provide you with that information. So I am very concerned that what we have here might not be the full story. I'm coming back to thank you very much for the report. It's something that we've been asking for some time, and it obviously took you a great deal of time and your officers a great deal of time to come up with this, and I am very appreciative of the work that your service is doing. It's a very difficult service, very challenging service, and there's been a tsunami of change since 2019, when I'm afraid the words that are coming from governing bodies that I sit on, the word that I hear even now is chaotic, and we never like to hear that, but you have moved on so much. But we have still got schools saying to us that the education, health and care plan situation is still not as quick as it could be, that it's difficult contacting individual officers regarding the plans, and just as important, that the money is not meeting the needs of that child and it's not coming to the schools quick enough. If you've got a school, and I'm talking about a school very personally here, that has got up to 41% of its children having either SEND or SEN, and if you say it quickly, you know, and in fact the statistics I've got from that school today suggest it's even more than that. What it means is every time you have a child with the need, yes, money is coming from certain sources, but the big wad of money is not coming quick enough. And if you've got a school that's got a budget that's straining already because of maybe reduced numbers, and we all have schools in our areas that have got reduced numbers, it's almost like a perfect storm. And what concerns me as well is that certain schools that have got children that really should be in a special facility are not coping very well in a mainstream setting, and for whatever reason they're being educated otherwise. And again, I hear of cases where we're talking about really no education going on at home. You know, the hours that are allocated and paid for by the school, because the child is still on the roll of that school, you know, it's still not giving that child an education. And then, of course, other parents are home educating not possibly because they desperately want to home educate, but they're finding it difficult to get the setting that they think their children require. So thank you for the statistics. I am a bit wary of the statistics, and the most important thing, I think, is to ask our schools what they think of your service. You know, the end users are always the ones that have lots to say, and should have lots to say, because we're talking about our most vulnerable children. And so I would ask you again to look at the statistics you've provided. Ask you again to look at the number of children that are not placed, because if it's 4 in one school, that's the information. Maybe this information is wrong, but I've got it from the horse's mouth, I suppose. And also, I'd like numbers about the children that are educated otherwise. Percentages in your report are all very well, but you go from numbers to percentages. I don't really like that very much. We want to find out exactly how many children are in the waiting room of being placed in a proper, specific, better placement for them to meet their needs. Because what happens is that the school is having problems meeting those needs for whatever reason. It impacts on that school because the character of the school changes. If you've got huge numbers, and 26 is a huge number, it means that the other mainstream children are being impacted. The children of the staff are being impacted, and the standards of the school are being impacted. So it's almost like a tsunami coming from various. So I would like to make certain that the statistics are correct, and as much further information you can provide us with actuals would be really useful. And I can provide you with this data, and I would be grateful for any comments on that. Thank you.
Thank you. Vikram, if you would, please.
Thank you, Councillor Sweeting. Yeah, so to start in regards to the data, this has come from census data that schools would complete as well as local authorities. So this was earlier in this year, so it could be a difference in where we are now to when this was published. But I will liaise with colleagues to ensure that we have the most recent up-to-date snapshot. Mindful that snapshots occur routinely throughout the year, so I will make sure that this is the most up-to-date. Councillor Sweeting, I did want to just pick up on your point that you made, which is an incredibly valid one, around schools with a high proportion, high percentage of children with EHCPs. Currently in Hillingdon, we are providing something called past the 3% threshold. I'm sure you're privy to it, but any school that has over 3% of their population with an EHCP, and we've now included early support funding, that middle tier of support. So any school that has over 3% of their population on EHCPs or early support funding are getting an additional £6,000 per pupil, deemed as place funding. So you will get, the school will be in receipt of the top-up funding for those children, but any child that's over that 3% threshold will also have access to that £6,000 place funding per child, which is a fairly unique position we are in Hillingdon. And I think that is something, in terms of how we're reviewing the DSG, is one of the items that we do need to review the longevity of. Councillor Sweeting, I just wanted to pick up on a couple of things that I jotted as you asked. The second just was around governors' briefings, and I think that's an incredibly important piece to this, and making sure that governors are privy to not just the latest update from SEND, but their roles and their responsibilities. I was a part of a really well-attended governors session in the midst of the pandemic. I think it may have been May 2020, and I know colleagues have been in subsequent meetings. I think the engagement of governors is an incredibly important one, so they understand everything from the position, but also in terms of fixed term and permanent exclusions and the identification of children with SEN. So we would continue and hope to continue to engage in those governor briefings, because that's really important. In regards to your point around individual officers, I think it's fair to say there has been some turbulence in regards to individual officers, and that has played out to our families, because it's those officers who are the front line. And we have heard stories of a change in a member of staff for one family, and then another change for that family. We have done everything we can to recruit to permanent posts. So as of, I believe, April or May of this year, we have recruited a permanent team with a permanent caseload. And there may still be challenges that need to be ironed out between that period and now, but there is certainly a lot more stability within the service. We're communicating with our schools around caseloads, making sure they're privy to their officers, as well as the senior SEN managers, but also liaising with Hillingdon Parent Carer Group to ensure that that's disseminated to our wider stakeholders, i.e. our parents. And as and when caseloads change, we're communicating those to our residents as well. So that's quite an important point to note. There was one other thing as I was scribbling, and I can't read my own writing, Councillor. So maybe I'll pause there and I'll take a second question.
Thank you. Yes, of course. But Councillor Hagar, you've been very patient. I'll come to you in a moment.
I am asking about SEND capacity, because I think what we have is a problem at the moment with the places that we're planning not being in place at the moment. So am I right in thinking that has had an impact on placing youngsters in the right setting? And what has that meant for the delay in actually placing the children in the right setting? And really more information really about the capacity and how it's going to improve the matters in the future.
Thank you. So one of the key challenges is certainly in regards to specialist capacity within Hillingdon, because the vast majority of our special schools are close to being full. We have a number of projects that are taking place that will provide additional capacity in the not too distant future, but that doesn't provide the solution for the moment. Apologies if I've misinterpreted, but I appreciate the challenge around some schools where there is a high number of children with SEN and how that is affecting the school. As I mentioned, one of our strategies this year is certainly focusing on some of those schools with high percentages to support those schools. So we will be utilising, in particular, the SEND Advisory Service to be working closely with those schools. I know we were having a discussion earlier this week about potentially one of the schools in particular. I don't know if you want to talk to Monica maybe about some of the things that are taking place with those schools.
Yeah, thank you. So I totally kind of accept the fact that this is an area of work that we need to focus, and we started this already. Actually, I believe there are still young people and children who are in mainstream setting that require specialists. We've been quite proactive sending surveys to schools to put these young people forward, and as well looking at our annual reviews. So we have also annual review project which we initiated literally last June, just to ensure that we review every single plan and we ensure that the child is placed in the right provision. It will take us time, but we are actively working on this. We actually reviewed over 200 now over the summer, and we managed to place children from, for instance, specialist resource provision who required specialist setting and move them to a specialist setting. So as much as this is a challenge about capacity, we're also working on reviewing these children, and those who are, as you mentioned, waiting, we're working on them and we are mapping them now.
Very much. Councillor Hagar. Thank you.
Thank you,
Thank you
Chair.
for your patience.
Thank you. Some of the questions have already been answered, and I'd just like to say congratulations. It is a very comprehensive report. I do feel we could have had a little bit more in there with figures and bar charts. I think you've sort of undersold yourself in a way, and I do believe we could have had a little bit better, so I'd like to have seen that. Definitely differentiations between 2 years ago to where we are now in the bar chart, and how we've managed to accomplish so much actually, which is great. I love the extended support programmes that came out right at the beginning a couple of years ago, where we recognised we needed to get in for those that didn't qualify for an education plan. I would like to have seen some case studies in here. I always believe results comes from our clients. So I would like to have seen some family case studies. I would also like to have seen how the Parent Carers Forum thought of this, and some examples really of how we've conducted our services and how they've helped. One of the questions I have is, I think it all looks amazing and it looks really good, but I'm just a bit conscious that it might look a little bit too good, if that makes sense. So 2 questions. We've completed all the assessments, 82% in 20 weeks. What I'd like to know is, out of that, what actual action has been taken. So I don't know whether the assessment's been done and then from the assessment how long it takes to implement, whether there are any still, whether they're done straight away. So that's the first one. And the second one is exactly actually what Councillor Sweeting said. What challenges do we see for the future? Because I'm aware that we've put this in place, especially the prevention. Are we going to be able to keep that going and continue with that? And how do we see an increase? So we've already seen a massive increase already, right? We've seen a huge increase. What's our prediction for the next 2 years, 3 years, 5 years, and how are we going to manage that? Some information around how many key workers we've got against caseloads would have been good. So it just gives me a little idea, you know, if we've got one key worker and then we've got 20 caseloads, it just sort of makes me work out how we're managing it. But a great report all in all. Thank you. Thank you, Chair.
Quite a bit there, Vikram. Can you help us with some of that at least, please? You might have to come back to us on some of it, but
I can. Well, I would want to stress that although the 20-week performance is looking much more positive than it was, and we've got strong engagement with early support fundings, that there are still challenges. There are national challenges, and it's challenges within the context of policy as well as the growth we've seen in the HCP. So I hope, although I've painted an accurate picture, it isn't 100% rosy. We've got a lot of work to be done around in developing special school places for our children and our young people, and we've got to ensure that the early green shoots, those emerging bits of work around early support funding, start to materialise even more so over this next academic year. So everyone within the service and wider knows just how important this academic year is, because we do have a degree of normality with our school settings, but it fundamentally boils down to the engagement with our school settings. Schools don't need to engage in those pre-statutory services, but it's down to us to promote, signpost and improve that offer. I can certainly provide you, following this meeting, with caseloads and numbers, so you know the sort of quantum people are working towards, as well as modelling growth. Last year was a bit of an outlier, so when doing some modelling for the DSU recovery work, we had made an assumption, I believe, of around 8% growth in the HCPs. That net figure was actually 10%. Now that 10% growth came with still the 250 plus children and young people accessing early support funding, and we saw a significant rise in new requests for assessments between January to June of last year, and we anticipate that that may continue into this year. So our modelling is intrinsic to that DSU recovery plan, because the DFE and the SFA certainly want to see what we think growth will look like over the coming years. What I can say, though, with a degree of confidence, is that the new early support funding pathway, as well as an area I haven't really touched on this, verbally articulated at least, around our educational psychology service, which plays a massive part in providing wider systemic support to schools, will be key pieces to that puzzle in terms of improving that wider early intervention offer.
Thank you. Councillor Prince, you indicate again. Go here, please.
Thank you. I just have a question on early support funding. I'm no expert, so please just tell me if I'm wrong. So is that for is that targeted towards children and young people who haven't got an EHCP plan yet? Is it that interim between perhaps applying and getting one? Because the teachers and head teachers that I've spoken to about this say the big concern for them is the money that the school has to spend before they get funding for a child who's got a plan. So I'm wondering about that, and 248 successful applications, is that a lot? There's no real, I don't know if that's a lot or not.
Yes, just to pick up on the first point, so within early support funding there is also another avenue of support called exceptional funding, and for that reason, so where we see, because of the nuances in Hillingdon, so for instance, the example of a new child, young person who's entered Hillingdon, with potentially complex needs, we haven't yet started the process of needs assessment, but we know that child will need an EHCP, go down the route of exceptional funding, and that funding is provided, I believe, quite soon after that process starts, so we don't wait for the 20 weeks. But that's absorbed within early support funding. But by and large, early support funding is there prior to an education, health and care plan. It's around schools signposting to us needs that need to be met at the earliest opportunity, and for us to provide that funding. And just to talk you through a typical case, I believe if a school provides that information, They provide it through something called a My Support Plan. It goes to our SEND advisory service. Within a fortnight, typically that child is seen and assessed. The great thing around the service at the moment is because the numbers are still quite low in comparison to the total population we have in Hillingdon, not only do we provide early support funding to that setting, but we also use some of the resource from the SEND advisory service, the professional resource, to then check on how that funding is being utilised. Now, as things progress and we see an uptake in early support funding, I'm sure we may be modifying how that works. But for the moment, there's a real onus on our professional resource servicing those communities and those schools, as well as the funding that's provided to those schools. But yeah, to answer that question, yes, early exceptional funding is absorbed as part of that early support funding. And that was actually feedback that we had captured from some of our head teachers who were saying it was taking too long to get the funding in that instance. And Councillor, I've forgotten the second question. Apologies. Oh, yeah.
It's 248 applications a lot.
Yeah, no, so apologies. So within the context, you don't know. So we can send a follow-up paper which has a bar chart which demonstrates the number of applicants against the number of successful applications. So we can provide that.
I've got two more people indicating. Tony, you've indicated. I'll bring you in first.
Thank you, Chairman. And I forgot when I asked my first question to add my thanks for the report and the signs that show somebody's getting a grip on of what's going on. And following on from some of the earlier things, I'd be grateful if you could share some of the work that's being done on modelling for the future with us. And my questions relate to, firstly, to page 27, where it talks about the use of traded offer to school and links it to the nationwide shortage of educational psychologists. I wonder if you could elaborate a little bit into how this is helping us to retain and recruit educational psychologists. And a final question I wanted to ask, you mentioned on page 28 about starting of SEND inspections. If we had inspectors in, what would they say were our areas of strength and needs for development?
Thank you. So the first question regarding educational psychologists. So the national context is that there is a national shortage in educational psychologists. So it is quite hard to attract and then retain our EPs. What we're doing at the moment, and also as part of that, we have a traded offer in Hillingdon. So our educational psychology service are doing three things. They are doing the nitty-gritty statutory work for education, health and care plans. They're also providing a traded offer to schools, which started at 0 in 2019 and is now at 60% of our school population, as well as some core work. And within that core work includes training to parent carers, as well as training to schools. So in terms of the national position, we are in a bit of a precarious position regarding the lack of EPs and the retention, because we know so many of those EPs can do locoming work and may not potentially be part of the full-time establishment. To improve that offer, though, we are thinking a couple of steps ahead. So, for instance, we work with a couple of the universities, so the Institute of Education, where we have trainee educational psychologists on board. We're looking to retain those services whilst they're still trainees, so we can grow our own, keep them on board. So there's some work that's going on there to try to strengthen that offer in regards to our educational psychologists. And apologies, because clearly my attention span isn't great this evening, so I'm going to ask you if you could just...
We've asked you a lot of questions.
It was a local area inspection, yeah. So the framework has yet to be published, and so Ofsted and the CQC will be working on that. Important probably for me to clarify that inspection isn't a local authority inspection, it's a local area inspection. So it's conducted by both the CQC and Ofsted. They will look at us as one of the key components to that inspection as a local authority, but also our CCG, as well as our wider stakeholders, i.e. our voluntary network, our school settings, and the voice of children and young people. We're currently, there were three key things that I wanted to get from our kind of strategic priorities over the coming months. One being the SEND strategy, the development of a SEND sufficiency strategy around places, and the third around a self-evaluation form. So that's the work that's currently taking place at the moment, just to ensure that we've captured everyone's views and thoughts, and also evidenced where those strengths are. As part of that governance structure, though, where we are seeing weaknesses, they will be linked to one of those 5 priority groups that I outlined at the beginning of the report. Thank you.
Thank you. I've got one last person indicating, Councillor McCarthy.
Thank you, Chairman. I'm not sure if you'll be able to answer this question because it's to do with the Children with Disabilities Service, but I'm interested to know because on page 27 it mentions about the short break service. So I just want to know what's being done to ensure that it's offered to all children with additional needs. If you're able to answer that, thank you.
I don't have the answer, but I can speak to my colleague Poppy, who can provide that.
If I can just make a general point, there have been a lot of requests for information. I'm just anxious we've captured it all, and I would ask perhaps that if Anisha can liaise with Vikram, if you can liaise tomorrow to make sure while it's fresh in our minds. I've made a few notes, but it's not comprehensive. I'm sure Anisha's captured it all, but if we can get that, that would be useful. Okay. Well, thank you very much, Vikram and Dominica. I very much appreciate your input this evening. We've given it a very good hearing. Understandably so, it's our job to really get into the detail and understand exactly where we are. There's a great deal to be positive about here. There's a tremendous work that both you and your colleagues are doing. It's enormously challenging. It's a demand-driven service with finite resources, so we're very aware of that and what that means in terms of what has to be done. I'm encouraged by the transformation side. That's so important, and very much look forward to seeing what's to follow, because we have got a paper coming up, if not the next meeting, the one after, it'll be around the SEND strategies, so perhaps we can have more on how this is being taken forward. But for now, I'd like to thank you very much indeed for your input. Quite apart from all the requests for information, which I know you'll liaise with Anisha on, in view of our earlier conversations this evening, I think that would be good. Can I just request one final bit of information? I asked about national performance indicators earlier. I don't think I heard a reply there, so perhaps could we, you might have done, and maybe I missed it, because we've had quite a discussion. I'm aware of, obviously, the 20-week ECHP performance indicator. If there's anything else, perhaps we can have that information too, please, at the same time. So, with that, thank you both very much indeed for a very comprehensive report and for your input into a very worthwhile discussion this evening. Thank you.
Are you okay for me to sit here, Councillor?
You sit where if you like. If you're more comfortable there, that's absolutely fine.
Well, thank you so much for having me today. And I know you've already heard some of this already, Councillor. I'm sorry about that. So in terms of today, last year I think the policy of the committees asked me to provide information that was over a longer period of time, not just 1 or 2 years. So I've now provided you with information that goes back over a 5-year period. I was also asked to provide information about all Ombudsman decisions, so you now have in the report every single Ombudsman decision that's been made in the past 12 months. The report provides you with high-level analysis. If you want more detail that drills down below that, that's available. You just need to let me know what it is that you want. So today it's just sort of providing you with that high-level stuff. What I'll do today is I'll concentrate on the elements of the report that apply to this committee, but I'm very happy to deal with any other things that you want to deal with as well. So I'll start off by the overall picture that emerges about compliments, complaints and members' inquiries, which is in Appendix B. In terms of complaints, the informal number of complaints has increased from 2,339 to 2,587 over the last 12 months. The formal complaints is at 789 in total for the whole year, and that's 70% of 2,587. So it's showing roughly that 30% is going on to the next level, which is the formal stage. And of the 789 Stage 1 complaints, 42 then went on to Stage 2, which shows that 5% of the 789 then progresses to the next level. Beyond that, the number of complaints then goes to the Ombudsman, and the Ombudsman investigated 34 complaints in total last year. Now, you probably think that's probably not a lot, and actually that isn't. The reason for that is that the Ombudsman, I think halfway through the year, they decided to pause all their investigations for about 5 months. So almost half the year, they chose not to investigate any local authority complaints. So it reduces the numbers, but it'll start to filter through, but it will take a bit longer. Personally, I would have preferred that they actually just carried out and done the investigations because we were ready to deal with it, but that's what they chose to do. What was a huge success last year was compliments. We had 502 in total. So if you had 789 formal complaints, then two-thirds, you had two-thirds of that type of figure was compliments, which is incredible. The one area that seemed to have had massive impact in terms of compliments is actually little wildflowers. They received compliments from everywhere. People were complimenting just how pretty it was. I think people had time when they were walking around, they noticed, and they complimented the council on that. So that was a massive surprise, but also, well-deserved, I think, for the Green Spaces team. In terms of members' inquiries, the year before we had 11,000 odd, and last year we had 9,960 in total, so a drop. But I don't think that's surprising, bearing in mind COVID and the restrictions in place, and how people had to behave in that period of time. Of all the members' inquiries that were received, 50% pretty much is all on waste. It's literally about there's a bit of litter there. Can someone go and collect it and pick it up? It was 50% of that was in that type of category. One of the things I need to sort of make you aware of is, and I think I have to thank Councillor Sweeting for that, is that you will find that in the report that I provided you with, the Uxbridge South figure is enormous in comparison to everyone else. I think what we've discovered, I'm not saying that the councillors didn't submit loads and loads of complaints, they did, inquiries, but they did. But actually, it was what happened within the system is that when an elected member makes an inquiry, the system that we use is called Onyx, and it relies on an address. So if you don't put an address in that, so if you ask, for example, how many toilets are there in the borough, or how many libraries there are in the borough, because it doesn't have a location, it automatically defaults to the civic centre. And because the civic centre is actually within Uxbridge South, you end up with a massive figure. There is no easy solution to this one, I'm afraid, because that's the way the system's designed. The only thing I can say to you is that in the next year or so, we are changing to a different system called GOS, and we're hoping that it will enable to recognise that actually if Councillor Corthorne submitted that complaint, then it's just in your ward. It recognises not the fact that you haven't provided an address, therefore it goes to someone else. So it's something that we need to sort out and that we're sort of working on. So I thank the councillor for that. In terms of what you'll be interested today is the number of inquiries from adult social care and children's. So last year, adults had a total of 145 members' inquiries, and for children's services, there was a total of 54. But what I'm about to say is probably a very strange thing to say to you, really, but I would say to you that of all those 145 and 54 adults and children's inquiries, I would say to you they are proper members' inquiries because they're actually asking us to do something which needs to have a proper response. What I mean is, if someone says to us, go and collect a piece of litter that's at the end of the road, that's easy for us to do. We just send a message saying, go and collect it, and it's done. But when it comes to adults or children's, it's asking us to do something that's difficult. It might be a child who's in danger or something's gone wrong. It could be about an EHCP plan that we haven't delivered on time, and it takes time to do that. So I think for the future there needs to be a discussion, I think, about what is a member's inquiry and how it's categorised. It's sort of a thought process that needs to go through, but it's perhaps not for today, but I just sort of throw that open to you. In terms of specific ones, and I know you'll have lots of questions, I hope, it's for Appendix D, it provides you with information about adult social care. The adult social care complaints procedure is unique in that the council has one opportunity to respond. So you have one formal complaint and then it goes straight to the Ombudsman. So for the adult social care complaints, we have an informal step And of those, there were 52 and 53 complaints that were submitted last year and this year. So volumes are not high. And then when you come to formal stage 1 complaints, there was 48 in total last year. So if you think about the volume of services that the adult social care provide, you're looking at about 100 informal and formal complaints in total across the year. So you're looking at maybe 8 or 9 every month, which is not high, and it gives you sort of a view that that things are generally going right. We get things wrong, and we do, and I'll talk to you about that in a little bit. But of those 100 odd complaints that we dealt with last year, 4 went to the Ombudsman. And it's telling you that if there was a massive problem within the system, you'll find that the Ombudsman will be dealing with massive amounts. And when you look at the Ombudsman decisions that they made, which are 4, they were actually either not upheld or did not investigate. So it's giving you a clue that the Ombudsman are feeling relatively confident of the ones they investigated, that we didn't get it massively wrong. One thing that both adult social care and children's need to get better at is the speed of responses. And I think sometimes elected members will say the same. Our responses are not as quick as they ought to be. But what I would say to you is kind of like weird, really, in some ways. I do want them to respond on time. I do want people to meet targets because it's important that we do. But there is a different point to that, is sometimes if you respond quickly, you sometimes get it wrong because you haven't thought about everything that needs to be done. The other thing that I've encouraged the services as a whole is dialogue. It's really important sometimes if you get a complaint to try and talk to someone about it, to try and sort it out. Because sometimes, from my experience, writing letters, emails or whatever doesn't generally work. Barriers tend to put up and it's harder to break down, but sometimes through dialogue you can sort it. So what will often happen is when a complaint comes in, I will say to the people, talk to them, see if it can be sorted through that. But by doing that, you have to then meet the timeline of the person who's complaining. So they may say, well, actually, I can't do it this week, but I might be able to do it in 2 weeks. But of course, immediately when that happens, you've missed your target. But actually, that's better than actually getting it wrong and trying to sort it. So when it comes to children's services, again, volumes are low. So there was a total of 86 informal complaints last year, and the number of formal complaints was rose from 71 to 87 for last year, which is a significant rise. Actually, that's 23%. The bulk of that was actually in the Send area, that the volume of complaints actually went up in that area. Part of the reason for that was that there was a restructure obviously going on. There was new staff that was dealing things, and it took time to deal with those things. So that was one of the areas that it's kind of like getting there, but the volume of complaints did go up, and part of that was in that particular area. But again, I would say to you, of the 87 formal complaints that were investigated, only 1 went to the Ombudsman in terms of children's services, and that was not upheld in that respect. So if you look at the trend, and if you look at the thought process, you generally start with a bigger level at the informal stage. It then reduces through the formal stages. But the key bit is, what's the Ombudsman thinking? If you're getting lots wrong and the Ombudsman's picking it up, then there are real significant issues, because the Ombudsman's independent and they're looking at things, and they're more, because they don't know the service as a whole, they're more likely to identify any source of issue. You're going to ask me what's the lessons that are learnt. I have to say, if you look at it this year, last year, the year before that, the main areas where people generally complain about is poor communication, and there will be a range of things. Either it's the communication that we've sent is either not good enough, it doesn't address their issues, or it doesn't provide them with the right information. But what's more infuriating is it provides them with the wrong information that even annoys people even more. Delays, people don't like. If you say we're going to respond on 1st of June, if you haven't responded by then, they don't like it. I think you're about to press that button, so I'm about to stop, Councillor.
Were you coming to a natural
yes,
conclusion?
Yes, I am.
Okay, if you're finished, that's lovely. Yeah. Good. Well, let me start by saying thank you very much for the report. It covers the wide range of services, you say. One or two surprises in there for me, I must admit. from my own experience within these areas of service, and also as a ward councillor, I must say. But it's absolutely right that we see the detail of this, and we understand within the areas that we cover what the learnings are, because I think complaints are a unique organisational learning opportunity, and it's so important that we understand those, particularly where there are process issues involved. And I suppose I've got a couple of questions. I'm sure my colleagues have got plenty as well, but let me start off perhaps with a couple. And one is around social care issues, and you've highlighted on page 51 that communication can be quite an issue. One of the things I've learned over the years among the service users we have within social care is good, sound, timely information is something they value above almost everything else, actually. And it just seems to me that clearly is an opportunity. So I wouldn't mind understanding a little bit more about what we are doing differently in relation to that. That's the first question I would ask. The other question in relation to complaints is a bit of a challenge back, to be honest with you, because I'm interested to see we have an informal complaint stage. I must admit I didn't know that. In my experience, and not necessarily related to this pot, but I find if the word complaint appears in an email or a letter from a resident, automatically invokes a formal process, which may not necessarily be the right thing, when perhaps a telephone call to an individual might resolve an issue at an early stage, perhaps not involving people of such great seniority in such a resource-intensive way. And I put it to you that are we perhaps a little bit too ready to treat things as complaints sometimes? You may disagree. So, two questions, a bit about social care, how we're straightening out that communication side of things, and also how we treat complaints generally.
The second one is fairly straightforward to deal with. The actual volume of complaints, if you actually look at in terms of formal complaints, they're actually quite low, but so are the informal complaints. But if you look at the other areas, if you look at the areas, for example, in terms of waste or housing, you find that the informal stuff is much higher because people are ringing in, and we're actually sorting those things out. But equally, the informal step is there, as you say, Councillor, just to begin the dialogue. We get lots of inquiries, complaints, whether it's either by email or telephone, and lots of those are dealt with by dialogue. That just happens. So I would reassure you that we definitely don't rush to go to the actual formal stage, because when you do, there is a bureaucratic process that sits behind it, and actually some people don't want that. Some people want a quick response and dealt with quickly, and an informal stage actually provides that, which is what people prefer. In terms of the communication side of things, what tends to happen is I tend to go to meetings of the senior managers and share what's been identified in terms of from a complaint. The only thing I have to be a bit conscious about is that I'm extracting information from a very small base. So if I'm then telling Tony Zaman or whoever saying, look, you need to do this because of this one or two complaints, the danger is that it might just be a one or two off rather than endemic across the organisation. But that's how it's fed back to all the senior managers. Okay, well that's encouraging to know, and also around the efforts we try to use to resolve things informally. That's good to know. Okay, let's open it up. What questions have we got? Councillor Sweeting.
Yes, thank you. Yes, it was very good to know that Councillor Cooper and her colleagues were not sort of rushing around and putting in so many millions of members' inquiries. I have got an issue with the audit of members' inquiries, because it's not just Uxbridge South where there's a problem. If you compare the information that we get monthly on the members' inquiries and that we all receive as members, it really doesn't tally with the information in this report. There's only 2 wards, as I can see it, where the numbers are very, very similar. In certain other wards, the numbers are out by over 2,000. So I would ask that you look again, and your main source of information comes from the MEs that all of us receive and we look at very, very carefully each month, because otherwise what you have here is not really giving a picture of what's happening ward by ward. So can that be included? Can you go back and look at that, and maybe it can be included in a further report coming to us? It may well be that, you know, we're talking about financial years, and we've only got, when we get the information, we only have it from May 2018, when we were all elected by the great Hillingdon public. So I think it's particularly looking at the figures for the last 3 financial years, if you like, because you've done that, by looking at where they are coming up to the end of the last financial year with the MEs, and that should then tally.
Before you answer that, Ian, I mean, just an observation from me. I was a bit surprised by some of those figures, to be honest. Looking at my own ward, where now I know that I know for a fact there are a significant number I put in personally. But I mean, just let me make that observation for now and see what you've got to say about what Councillor Sweeting said anyway.
Very happy to do that, Councillor, and go back and look at the other areas. There's no difficulty about that, because the reason for that is because it just comes from one source. When a member's inquiry is logged, it's logged into a system called Onyx, and so the information that you get every month and that I provide you is all come from the same source. The only difficulty you might find is that it may not exactly correlate, but I did check with Mark Braddock before I actually came to the meeting, and we agreed that it kind of like tied together. But I'm very happy to go back and have a look at each one.
Thank you. Did you want to come back on that?
It's just that your email to me did say that it did rely on the officer inserting a location. So I don't know whether there's that part of it that would have caused a problem. But certainly if you do look at the information, and Mark has also confirmed that it's our monthly audit that's the correct audit. If we use that as our base and do the audit from that, I think we will be much happier with the figures before us.
Very happy to do that, Councillor. It's sort of kind of like dead easy to do, really. But the latter point that you make, can it be human error? Yes, absolutely. You know, sometimes it's possible that if I enter information, not that I do very much in terms of that, but if I do enter the information, I may miss the address, and that would therefore be rather a system fault. It's a human error. So, you know, I acknowledge that there may well be that as well.
Councillor Deed. Councillor Haggard.
Thank you. I always welcome your report, I have to say, because when I look at it, it has everything that I want in it. So I'd just like to congratulate you. I know I've said that before, but the one report that comes to committee, it's got statistics, it's got complaints procedure, it's got everything about, it's got case studies, it's got the lot in here, and you know, that's really recommendable. So you might not be able to answer this question. I don't know whether it does actually fall in your remit. So if you can't answer it, that's fine. But I've actually had a lot of complaints and inquiries about trying to get through to inquiries and complaints. So I'm not quite sure whether that falls in, especially at the moment where there seems to be half an hour waiting times to an hour waiting time. They're logging on and they're not being able to put through the inquiry, or the inquiry is incorrect. And I liked what you said at the end. I know you summarised, but you did say what we're doing now is we're trying to rectify where some of the complaints come in, but they're not actually correct. And I just wondered, because we haven't actually got that in here, but I didn't know whether it might not fall in this remit. I don't know. Thank you, Chair.
In terms of the submitting a complaint, I guess we tend to rely on the council's web page, because that's where all the information is. I tend not to get people complaining about not being able to get through to the complaints team, but I do get people contacting me saying they can't get through to other services and there's delays, and so there is that element of that. The way the system works is that people generally will call the contact centre, and then they will then filter the call through. I think what sometimes happens is that over the last year or so, there have been quite a few people working from home, so sometimes it's harder to put the call through. But all calls should be diverted to a particular point. So it's kind of like difficult to answer, other than to say that there is the contact centre, and the complaints team's telephone number is published, so they can ring through on that. On the website also there's the form that they can use, and it just comes straight through to a complaints, or alternatively send an email. So all those systems are there. So I would say it's there, but sometimes it's not easy to find, and I guess that's what people struggle with sometimes. So yeah.
Tony, you indicated?
Thank you, Chair. A comment that is, obviously I'm not a member of the council anymore, but the analysis of members' inquiries doesn't suggest anything in the relay of roads and parking and similar type issues. But that was a comment. Now I have a question, which is relating to Appendix F, because you didn't say anything about the education service, and whether there were any lessons we ought to be learning from the types of issues that come before it.
In terms of roads, that's under highways, so any sort of members' inquiries under highways would be to do with roads.
That's not in the
hold on.
Page 36.
Yeah. Oh. Yeah, what I've done there is, oh, I see. Yeah, so it will be under highways. What's happened is that because the number of them were not significantly high, I've just simply put down the highest numbers. So if you want the highways numbers, I'm very happy to give that to you. That's no difficulty. In terms of parking, that generally appears under business and technical support. It used to sit under that because the person in charge of that at that time, that was the area that it sat under. Since then, it's moved under to a different area. But I can give you that figures if that's what would you like. That's.
I was just surprised.
Yeah.
Because when I was a member, I had a lot in those.
You did.
In those areas, yes.
I can't remember what the other.
It was relating to education.
Oh yeah.
But you didn't comment on education.
No.
As to any lessons from the types of area in which complaints are made in education.
Yeah. Appendix F contains the education information, and in terms of education, the volumes are really tiny in terms of either informal, formal, or LGO investigations. So, for example, in terms of the informal investigations, last year it went from 8 to 22. So, it's in terms of percentage, it's a significant rise. But the bulk of the reason why it's increased was to do with Ofsted. What Ofsted did during that period is that there was a sheer number of communications that they sent to the council to investigate, and it related to school issues. So, for example, what happens is if people complain to Ofsted about a particular school, if Ofsted decide that it's not one that they would investigate, they pass it to the local authority, and it's those complaints that come to us. So we had quite a significant number last year that the local authority had to look into. They tended to be about behavioural issues. They tended to be about curriculum. They tended to be about graffiti. There's quite a few abuse where there's allegations of abuse that are made within the school setup, and Ofsted pass it to the local authority to deal with. What generally happens is the local authority designated officer will look into those and provide a view as to whether, what's happened in that instance. So that was the reason why the informal stuff went up from 8 to 22. In terms of the formal complaints, it went from 16 to 3 last year, so it's a massive reduction in terms of numbers. But I think part of that was to do with the COVID situation and the fact that so many children were either at home and schools were closed, so the numbers just decreased in terms of that. In terms of the local government ombudsman, there were no investigations that they undertook last year for the education service. But interesting enough, the compliments went up from 1 to 4, so that's quite a pleasant surprise. But education is one of those areas that at the moment doesn't attract a great deal of complaints. Part of that is, I suppose, because the local authority's involvement in the education sector is quite small. In terms of we can look at the actual curriculum that the school has got, and we can look at some more wider issues, but generally we'll ask people to go to the school to submit their complaints because it tends to be a school issue that needs to be resolved within the school. But it's an important area, but a small area in comparison.
Thank you. I've got a further question. I suppose it relates to my own experience raising queries, not so much within this POC's area, Select Committee's area. I beg your pardon, that'll cost me that, won't it? The Select Committee's area. But generally speaking, if there's an issue with a service request that goes through the contact centre, shall we say. Now, I've done that on occasions. I'm not looking for a response. I'm working on the basis that it will be addressed unless I hear otherwise. But it's nevertheless treated as a member's inquiry. I'm not actually asking for a response. And I think, part of this reporting process is surely about making sure we're making the best use of officer time. This ties officers up in an awful lot of time. So anything we can do to make them, give them a chance to use their time more efficiently around what they're actually paid to do would be a good thing for us all, I think. And I just wonder whether sometimes, again, a bit of a challenge, are we too ready to treat things as MEs when in fact they're only service requests? And I wonder whether part of the answer to the question around the numbers of MEs is perhaps we can look at that differently. I know there's some discussion underway about that. My other point I would just mention briefly is around the whole digital agenda, and whether through the My Account process there are perhaps opportunities to give better information to people that can reduce the need for quite so many members' inquiries and also help members at the same time. So a couple of thoughts. I've just welcome your comments on those, please, Ian, if you wouldn't mind.
In terms of the digital side of things, I think that was, funny enough, that was a discussion that took place at yesterday's Select Committee as well. There is a digital agenda, and I think there is a need to have a website that suits the needs of our residents, I suppose. But I guess that would be for Perry, Scott, and others to respond to in that respect. But in terms of the initial question, you are right, absolutely right, in that when a councillor submits something, initially the member of staff will think elected member, therefore it's got to be a member's inquiry. It's like almost automatic pilot in terms of thinking. It's in some ways the member of staff does that only because it means that it's going through an official channel, because my team are told, and we tell others, that if an elected member makes an inquiry, then therefore they need to come through my team to deal with that. So maybe that's some work that my team need to do in terms of progressing that. But the other question that you raise, Councillor, is sometimes some people write to you a few times, maybe more than once, and actually maybe you're not best placed to actually deal with that inquiry because it's an inquiry which needs constant information or an update. What I've done with some councillors is that all you need to do is just send it to me and just say, look, got this inquiry. Let me have the copy of the response that you send, but can you deal with it and take care of it? I'm very happy to do that, and that's what happens in some instances.
Okay, thank you. It feels like an opportunity to me, but that perhaps needs to be taken away. We are asked to give you our feedback this evening, so take that bit of feedback from me if you wouldn't mind. Okay, so I've got Jan indicating.
Insufficient evidence is often used by the Ombudsman, by police, and us actually as a council to close cases. And it's an issue that I think that we might be able to provide more information to residents on what would actually constitute enough evidence to take matters further forward. I know that I've got quite a few cases of antisocial behaviour, that it's gone from one stage to the next stage to quite an important stage. But I keep on guessing where there's not sufficient evidence to take this further forward. And I do think maybe the council is losing a plot on that, and maybe we can provide examples of what evidence would be needed to take an ombudsman matter further forward.
Yeah, this is a funny one that the ombudsman deal with, because you often get a decision from the ombudsman which says did not investigate. Now, if I was a resident, I would think did not investigate. Someone didn't bother looking at anything, but actually that's not the case. What happens is when the ombudsman gets an inquiry from a complainant, they ask the council to send them literally the whole file. So the council then provides them with the whole file, and what happens is they then look at that, and then they make a decision as to whether they plan to investigate it any further, or whether they're just going to put a decision which says did not investigate. So they do get all the information, councillor, in terms of the information that we provide, but what sometimes happens when they use the word insufficient or did not investigate, they just mean that there isn't insufficient evidence for them to justify an investigation. So basically what they're saying is that what the person who's submitted the complaint is not a complaint that they feel is justified. That's essentially what they're saying, but they use a different language to put it that way. But that's the way they work. That's why they say did not investigate, when actually they've looked at it, we provided all the information. But in terms of what the residents need to provide, what the Ombudsman do is when a resident submits a complaint to the Ombudsman, they have to complete a form, or they call the Ombudsman and they tell them whatever their complaint is, and the Ombudsman writes that down. So they have that opportunity to do that. But if you're asking me, do they know what to say to the Ombudsman, that's a difficult question to kind of like answer. But what they do have to do is tell them what their complaint is in their own language and words, and the Ombudsman can then decide what they want to do.
There's one case in
particular. Carry on, Jan. Sorry, carry on. Go on.
There's one particular case where you've got the comment limited injustice caused. That's complaint reference on page 72. So what does that actually mean? Limited injustice caused.
This is kind of like, it's kind of like the language that the Ombudsman use when they use limited injustice. So, for example, if if someone asks for a they say that then there's a fixed penalty notice that's been issued to them for whatever reason, but for whatever reason the Ombudsman decide that there is a proper process that's open to them to challenge that. So they'd either challenge it through the courts or they will challenge an appeal process. So what the Ombudsman will then do is they'll simply say there's limited evidence to suggest that it's a case worth of merit. It's kind of like language they use. It wouldn't be the language that I would use, but it's what they choose to use. It just literally means that there is the information that they've got is not sufficient for them to progress it. It tends to be used more when it comes to things like planning, where someone applies for a planning permission and someone then complains to the council for whatever reason that they're not happy with, but actually they've got the right of appeal to the planning inspectorate. So it's that type of thing that they... But for a layperson looking at it, you are right, councillor, the language, it's not that one that I would choose to use.
Thank you, Jan. Kerry, you indicated?
Thank you. Just looking now at compliments, it's really nice to see that during a very horrible year there's been a significant increase in compliments. I wonder if it's appropriate for us to minute our note of thanks to our frontline staff who have created those compliments, because it makes us look good, whether that's worth noting. And just some curiosity, I wonder if you could humour me on page 72, which I know isn't the brief of this committee. Oh, you put it there, sorry. The bottom of the page, Mrs X complained that the council buried her mother in the wrong plot and the council offered her a fair remedy. What remedy does that create?
Sorry, which one?
Page 72, the one at the bottom, the Ombudsman did not investigate because the council offered her a fair remedy to her mother being buried in the wrong plot, and I'm just interested what possible remedy that could be.
Do you happen to know?
You might not know that granular.
If not, let us know. Do you happen to know?
I do know it intimately, actually, councillor. In terms of the compliment side of things, actually, councillors have sent in compliments as well, so we thank you for that. That's really appreciated, and it is welcome to do that. This was a case that I was quite closely involved with. I suppose I have to be a bit careful in terms of what's said. What happened was, in error, the gravedigger dug a plot, and someone the woman was buried in that plot, but it transpired that that plot was actually owned by someone else. So it became a very difficult issue after the event. So what the council had to do was it had to decide what the right thing to do by the person as well as the council. There was an element of compensation that was offered to her. What she asked for, and we gave her, was a bench with her mother's name and the dog's name nearby. We offered to repurchase the plot if that's what she wanted us to do. We offered to give her a plot next door, but I think, to be fair to her, I wouldn't want my relative to be exhumed in terms of that. So it stayed where it is, but we did offer to do what we could to support. But I think the main thing that we did do was put a bench, and I think she wasn't happy with what we did because we got it massively wrong, and we did get it really, really wrong. But we tried to put right what went wrong. But in that instance, really, it's difficult to put it right.
Indeed. I noticed that one as well. And again, sometimes you can only do what you can do. And there we are. No one else is indicating, so I'm going to wind up the discussion. Ian, I'd like to thank you very much indeed for the report you've brought to us. I was always fascinated by this information. I was a cabinet member. It's very important that we're focused on it. And I think what we should remember is that behind all of this activity is an enormous amount of work done by an awful lot of people in our name as members. The vast majority of people who pass through our services have the highest regard for them. We should never forget that, and I think the compliments that we can see are testament to it, and I will happily associate myself with the suggestion of Councillor Prince that we do extend our thanks to all officers within our service. It's important we do that. I think dealing with these things in the right way is evidence of an organisation that's committed to continuous improvement, and that's so important. So I think with that, I think we'll leave the matter there, if that's okay. If we can agree with the recommendation, I'll thank you, Ian, and we'll move on. Thank you very much. Microphone, thank you, Vice Chairman, for pointing that out. I'll say that again in case the camera, the recorder didn't pick that up. Onto the work programme. Any comments on this item at all? Any comments or questions? I will just say, sorry, did you indicate, Councillor Hagger? You didn't. I will just say that there's a possibility that the new SEN strategy may have to move the meeting. I did hint at that earlier. I don't know yet, but we'll bear that in mind. We've already got quite a meaty meeting, if I can put it that way, in October, so it may not be a bad thing, but we'll see what happens, and I'll keep people informed. That's all I have to say on that at the moment. Are we otherwise happy? Can we agree that? Thank you very much. And finally, the Cabinet Forward Plan. Any comments or questions on that item? No? Apparently not. Okay. Can we agree with the recommendation? Thank you very much indeed. Thanks everyone for your input this evening. I think we've had some good full debates on things. It's important that we do. It's our function. So thanks for your contributions. Thanks very much indeed. Thank you.